In tonight's Big Story Breakdown, we're looking into all the things impacting your health. Mental health and substance abuse services for Oklahomans on the line once again as the state agency makes swift cuts to help climb out of a financial crisis.
Some providers across the state tell us they were blindsided and will have to stop some critical services as early as next month.
They knew budget cuts from the state were coming, but not this severe.
I out loud said, wow, and I could feel tears welling up.
Oklahoma Citizen Advocates for Recovery and Treatment Association, or OCARTA, got this email Friday afternoon stating starting October 1st, the Department of Mental Health wouldn't be renewing several of their contracts, totaling nearly $640,000.
And immediately we started asking why.
Executive Director Brandy Vore expects to have to close the doors to their peer-run drop-in center, which serves around 3,500 Oklahomans each year. And they'll have to end a program for pregnant women who are homeless, connecting them to prenatal care and addiction recovery. Programs, she says, have proven to keep people from returning to jail, crisis care, or the streets.
I really didn't understand why you're just not going to fund these life-saving things. These aren't fluff. This isn't trimming fat.
The state contracts with OCARTA are among around 700 the agency has been evaluating. Another nonprofit, Oklahoma Alliance of Recovery Resources, says they were verbally told they were losing 20% of their funding from the state, but they've yet to receive written notification. A spokesperson for the Department of Mental Health tells us some contracts are canceled, others are being amended. She could not tell us the total dollar amount or how many providers are impacted.
I declare the resolution to have been adopted.
It comes amid a massive effort over the last year to turn things around at the state agency. Multiple investigations uncovered deep financial issues, and the former commissioner, Ali Friesen, was ousted by lawmakers. The legislature also poured tens of millions in extra funding so the agency could get through the 2025 fiscal year. In a statement to Fox 25, Interim Commissioner of Mental Health Greg Slavonic says these were very difficult decisions, but we cannot spend more than we have. We are committed to our state leaders, taxpayers, and most importantly, the Oklahomans we serve to provide quality care within our allocated budget. While a state agency works to get back on solid ground, the consequences, some warn, will be devastating. You really believe this could cost lives?
Absolutely. It will cost lives.
And we're hearing from Tulsa-based Family and Children's Services. They tell me the state's pulling $1.5 million in funding to some of their programs. FCS calls it concerning, but says COPES and the Crisis Care Center will still be available 24/7. You can find their full statement along with the entire statement from the Department of Mental Health addressing these cuts on OKCFox.com.